We are going to talk about respiratory medications and the PTA role in pulmonary treatment. As you know, we do not prescribe or administer medications, but we need to know about them. We need to know the effects of the medications and how it's going to affect our patient's therapy session. So, after completing the lecture, you should be able to explain and discuss the main categories of respiratory medications, recognize the common side effects and their impact on therapy. That's the important part that we need to know. Understand the PTA's role in pulmonary patient care, and apply the knowledge to clinical decision making. Recognize when to modify treatment based on respiratory status. So, the we'll just go through basic respiratory medications that are used. Bronchodilators, just like they sound, they dilate the bronchioles. Their primary use is to treat asthma, COPD, and conditions that obstruct airways. So there are two different kinds, short acting and long acting, basically. They call them short acting beta 2 antagonists and long acting beta 2 antagonists. So sometimes they use them for conditions. Several years ago, I had pertussis, and they gave me an albuterol inhaler 4 times when I had difficulty breathing, and until I got over the pertussis, which was great. And it quickly decreases bronchial constriction. It's used for acute respiratory distress. It can be used 20 minutes before exercise to prevent an asthma attack. So people that have exercise-induced asthma, which is due to reactive airways, they will use an albuterol inhaler. There are these long-acting beta 2 agonists that maintain an open airway and prevent bronchoconstriction. They're mainly used for asthma maintenance. So people that have intrinsic asthma, which is also called exercise-induced asthma, it's generally diagnosed when you're an adult. They kind of know what the triggers are. They have reactive airway disease is like precursor to that. People that have extrinsic asthma, it's usually caused by a type 1 hypersensitivity or allergic reaction. So if you can avoid allergens, that's a good way to avoid exacerbating the symptom. And then a lot of times you don't have to use bronchodilators. So anticholinergics are used to improve lung function and prevent exacerbations in asthma and COPD. The common examples are Spiriva is the brand name. So most of them end in ropium. If you see ropium, then you know that it's an anticholinergic. A lot of medications, their generic name has a common ending, and you can kind of classify it that way. And if you don't know, you can always look it up. Common side effects of bronchodilators are dry mouth, tremor, headache, heart palpitations, muscle cramps, coughing, nausea, vomiting, and diarrhea. So lots of side effects. And so they really have to decide if they want to use that. So you're going to monitor for tremor and palpitations that might affect balance and exercise tolerance during therapy sessions. So that's what we really need to know is how's this going to affect our therapy session? With the inhalers, sometimes we're not going to administer an inhaler to someone, but one time I was working with a lady and she said, I think I'm starting to have an asthma attack. And I said, do you have your inhaler? And she goes, it's out in the car. And I said, give me your car keys. I'll go get it. So she gave me her car keys. I ran out to the parking lot, got her inhaler, and then she self-administered. So, if you know what the patient needs, if they have it, then you can help them with that. But they're going to self-administer. So, antimicrobials are going to be used for pulmonary infections like pneumonia or people that have infections associated with cystic fibrosis. They might use antimicrobials in that case. So all the different antimicrobials that you know. Side effects, nausea, vomiting, diarrhea, sun sensitivity, and yeast infections. Antivirals are used to treat some viral pulmonary infections. Antivirals only work for one thing. So Tamiflu works for the flu. Relenza works for one thing, The one for COVID, Paxlovid, only works for COVID. So antivirals are specific to the virus. So if there's not an antiviral for your virus, sorry. Bad side effects, just like medications are all potential poisons and they could cause side effects. Antifungals are used to treat fungal pneumonias. Fungi are eukaryotes. They need different drugs than bacteria, which are prokaryotes. So fungal pneumonias, including histoplasmosis, are often treated with antifungals. They can cause life-threatening allergic reactions, so you really have to know that that's what you want to take. Serious. So expectorants and vaccines. Expectorants are mucus thinning drugs. They thin mucus and lubricate airways. And so it helps get the secretions out of there and clear airflow obstruction. So guaifenesin is a common over-the-counter one, but they have prescription forms of it. Different side effects, but usually that expectorants can be really helpful for clearing the lungs. Flu and pneumonia vaccines are critical for high-risk patients. If somebody has chronic pulmonary conditions, or they're immunocompromised, or they're elderly, or they have other comorbidities, the flu and pneumonia vaccines can help prevent complications of those diseases. So our role in pulmonary care, we need to be aware of common conditions like exercise-triggered asthma or intrinsic asthma, post-surgical pneumonia risk, pulmonary emboli. We need to be aware of risk factors like smoking or being exposed to asbestos or coal or air pollution. Most patients, or not most, but many patients have some sort of pulmonary involvement. So even if we're not treating them directly for a pulmonary disease, they might have some pulmonary involvement that we need to address, or they might be on medications that might affect our treatment session. So the essential skills that we need to vigilantly monitor for respiratory difficulties. Make sure we know what our patient's respiratory status is. Competent vital sign assessment. So practice and get better. Your vital sign assessment. Quick and appropriate emergency response. Know when it's time to call 911 or call in the team if you're in an inpatient facility. Patient education on smoking cessation. Newsflash, smoking's bad for you. Risk factor modification counseling. So if we know all the risk factors, we can help identify those for our patients. And there are things that you can change and there are things that you can't change. Well, let's change the things that you can change. When to stop treatment. If somebody has sudden onset of shortness of breath, stop it. Stop treatment. If somebody has chest pain or tightness, stop. If somebody has excessive coughing during activity, stop until they stop coughing. If they're turning blue or white or red, stop. If they are dizzy, they say, oh gosh, I feel dizzy, or they are showing signs of altered mental status or confusion, that's a good time to stop and notify the appropriate people. So before exercise, if somebody uses a bronchodilator, let them use it. Say, hey, do you need to use your inhaler and before we start exercising? And they might go, oh, right, I forgot to do that. Let them know. Monitor their side effects. So if they have a tremor from their medications, their anticholinergics that affect balance, if they're sedated from expectorants, that's going to affect, those side effects are going to affect your treatment. You might have to adjust the intensity based on their respiratory status. If they're having a little more difficulty breathing today, you might have to pace them down. That's one of our big skills, is knowing when to pace up and when to pace down. Education, you can help the patient with proper inhaler technique and recognition of symptoms. So we don't administer the drugs, but we can help them with the proper way of administering them. Key takeaways: bronchodilators are a mainstay of obstructive disease treatment. Side effects can directly impact physical therapy sessions. Anti-infectives treat various pulmonary infections. Prevention through vaccination is crucial for high-risk patients. So anybody living in a long-term care facility needs, any elderly person in the hospital needs to be up to date on their vaccinations. We have to be vigilant, we have to be competent in assessment, and we need to be ready to modify our treatment based on how the patient is doing that day. Remember, your role is critical. As a PTA, you are often the healthcare provider spending the most time with patients, and your ability to recognize respiratory changes and respond appropriately can be life-saving. So don't overlook monitoring their vitals and making sure that they're taking their medications properly and that sort of thing, because that can be critical in the time that we spend with the patient.